Hello, and welcome to the fourth in our series of presentations on somato-autonomic regulation of cardiovascular function. In this presentation, we'll take a look at studies showing how somatic stimulation modulates autonomic output to the cardiovascular system in both animals and humans. If we look at the total number of chiropractic patients studied, we would have to say that there's a fair amount of evidence concerning the use of spinal manipulation in the management of hypertension, and not very much at all looking at the management of arrhythmias. Furthermore, the designs most often used do not permit generalized conclusions about the effectiveness of manipulation in the management of cardiovascular disorders. Consequently, at present, chiropractic management of patients with cardiovascular disease should be regarded as experimental and should be approached with considerable caution. On the other hand, basic scientific studies of somatocardiovascular reflexes are well established. This study from 1984 looked at cardiovascular responses to mechanical forces applied to the spine in anesthetized rats. We see that in animals with an intact central nervous system, mechanical force applied to the lower thoracic spine produced depressions in renal nerve activity, heart rate, and blood pressure. On the other hand, when the cervical spinal cord was cut to eliminate input from the brain, renal nerve activity and blood pressure increased, whereas there was no change in heart rate. This suggests that the brain mediates a generalized and depressive response to forces acting on the spine, whereas at the spinal cord level, the reflex responses tend to be excitatory and more specific. In more detail, in this case, a force applied to the lower thoracic spine affected the renal nerve and so blood pressure, but could not affect heart rate because there's no autonomic input to the heart arising from the spinal cord at the lower thoracic level. Work conducted about a decade later examined the effects of laterality and vertebral level on heart rate responses to pinching of different dermatomes. As the top panel illustrates, when the central nervous system is intact, pinching any dermatome produces a rather muted response in heart rate. However, as in panel B, when the cervical spinal cord is cut to eliminate input from the brain, only input from dermatomes linked to autonomic output to the heart affect heart rate, and they do so quite profoundly. Furthermore, there's a clear laterality to the reflex, with input from the right side of the animal being much more effective than input on the left. Why should this be so? Because heart rate is most strongly influenced by input to the sinoatrial node from sympathetic fibers originating on the right-hand side of the upper thoracic spinal cord. From a basic scientific point of view, it all makes perfect sense. There are now hundreds of similar papers showing fairly consistent results, and they permit certain predictions about our patients. The basic scientific evidence predicts that either gentle or noxious input to somatic tissues should produce responses in the autonomic regulation of cardiovascular function, and that the resultant effects depend on the laterality of the stimulation and the level at which the sensation enters the spinal cord or brainstem. However, the evidence also predicts that if the brain and spinal cord are communicating with one another normally, any responses in cardiovascular function should be very muted and unlikely to be clinically significant. Input from the upper cervical region, however, is likely to be a special case. In this study, the investigators recorded the activity of various visceral nerves as they manipulated the heads and necks of anesthetized cats. In the top figures, where innervation from neck muscles was intact, manipulation of the head and neck produced no significant change in splanchnic or abdominal nerve activity and a predictable change in hypoglossal nerve activity, the latter related to a reflex protrusion of the tongue when the head tips up. In the lower tracings, where input from cervical muscles was removed, any neck movement caused profound responses in all nerves due to the unbridled input from the vestibular apparatus. What this tells us is that when the neck muscles and vestibular apparatus provide coordinated information, head and neck movement result in mild and adaptive changes in autonomic function. However, when the neck muscles and vestibular apparatus present conflicting information about head and neck position, there is a resultant storm of autonomic activity. This, in fact, predicts what we sometimes see in patients with neck injuries, such as whiplash, where there are severe disturbances in all sorts of autonomic functions. So back to humans. Here's a single tracing of heart rate and blood pressure in a human volunteer receiving a single upper cervical manipulation. The acute responses are obvious. However, these responses disappear very quickly and are of no particular clinical importance. By now, we have hundreds, if not thousands, of similar recordings which tell pretty much the same story. Virtually everyone shows a short-term cardiovascular response to cervical manipulation, and it is seldom of any clinical significance. In the laboratory, we can also look at slightly longer-term responses over the course of several minutes, using analysis of heart rate variability. There are now probably dozens of such studies which almost invariably report some response. However, there are some important limitations. First, almost any stimulation alters heart rate variability, and so there's going to be a lot of background noise in our measurements. Secondly, small changes in heart rate variability are almost always good. It doesn't matter if, for example, sympathetic output is going up or down. Any small change is likely to be an adaptive change and so good for that individual. Finally, with HRV, we are only measuring effects on heart rate. We have no idea how our treatment might be affecting autonomic output to, for example, the respiratory or digestive systems. Consequently, at this point, analysis of HRV is a very interesting experimental tool. However, it has no particular role in telling us whether our treatment had a beneficial or detrimental effect on the health of our patients. At this point, analysis of HRV belongs in the lab, not in the clinic. So let's look at some lab results. Here's a study examining effects of cervical manipulation on healthy young adults. In this table, we see that with a sham manipulation, there was no significant effect on sympathetic or parasympathetic output to the heart, although when we compare average heart rate in the 5 minutes before manipulation to the 5 minutes after, there was a small decrease. With an authentic manipulation, however, there was a significant increase in sympathetic output to the heart. Similar results have been reported numerous times, but there's no implication of clinical significance. In fact, often you don't even need to process the data or perform statistical analysis to see the results. Just looking at raw heart rate, one can often see an instantaneous change at the point of manipulation. Sometimes, however, the changes are dramatic enough that one has to consider the clinical implications. In this case, we have a young man with a history of arrhythmia dating back many years, and the arrhythmia resolved immediately at the point of application of a single cervical manipulation. Cases like this are extraordinarily impressive and beg the question of whether the outcome might be repeatable and in whom. The basic scientific evidence confirms that somatic stimulation routinely affects cardiovascular function, and in some cases this can be of clinical significance. The lucky patients, however, are in the minority, and at present it's difficult to predict which patients with cardiovascular disease would benefit from manual therapy. Furthermore, in the current political environment, despite any potential benefit to patients, there's little appetite for pursuing research beyond the use of manual therapies in the management of biomechanical symptoms. Thank you very much.